Today's topic is ocular injuries. It is a vast topic. It will be divided into at least 4 to 5 lectures. As injuries, they range from mild to severe, sight-threatening to life-threatening. It encompasses all age groups like pediatric to geriatric. So it is a very vast topic. Also, depending upon the nature of injury, you have mechanical, thermal, radiational, chemical, so all sorts of injuries. So it will be covered over a series of 4 to 5 lectures. Today we will have an introduction to the topic of ocular injuries. What is ocular injury? It is damage or trauma which is inflicted to the eye by external means. So some external objects, maybe chemicals, maybe radiation, from externally inflict trauma to the eye. The concept of ocular injury includes both surface injuries, where only ocular surface is involved, like conjunctiva, cornea, or it can involve intraocular structures. Now, during trauma, there can be soft tissue injury as well as bony structures around the eye may be involved. Injuries have their effect depending upon their severity. If the injury is very mild, there may not be any effect on the vision because of the injury. Vision will be preserved like that. Moderate and severe injuries can have vision threatening effects, like patient may be losing all his vision, or there will be partly loss of vision. Also, moderate to severe injuries, they may incite collateral damage to the ocular and orbital structures. So neighboring structures like extraocular muscles or lacrimal apparatus or lid or bony structures, they may suffer from collateral damage apart from damage to the eye. Now, sympathetic ophthalmitis is a condition where even normal eye which has not suffered from any injury, it may show inflammation if the affected eye involves perforating or penetrating injuries with prolapse of uveal tissue. So here your concern is not only the eye which is traumatized, but other eye which is normal otherwise may suffer because of the injury to this eye, that is known as sympathetic ophthalmitis. So in general, injuries are very important from the vision point of view, from the point of view of damage to the collateral structures, and many times there is associated head injury where there can be life-threatening complications to the patient apart from the ocular injuries. That is why it is very important to study various types of injuries. Also, there is one more aspect in studying the injuries is medico-legal aspect. Many times these patients who suffer damage to the eye in an accident or because of some alleged trauma, and if they lose their vision, they can sue the opponent in the court of law, where doctors, ophthalmologists are invited, and their opinion is of very crucial importance as far as how much damage to the eyesight is done by the injury. So from medical legal aspect also, the injuries you must know in details. Now, as I have told already, the vulnerable population is those who are working outdoors mainly, even though inside also there is injury is likely to happen, but most of the vulnerable population work outside, and they may be involved in sports, they may be industrial workers, they may be farmers and construction workers. I did not tell you the examples of sports injuries Many of you who follow cricket must be knowing there Mansoor Ali Khan Patodi, who lost his eye, the famous Patodi, who lost his eye in a cricket ball injury. Recently, Saba Karim lost his eye while keeping wickets behind the stumps, and he had because of blunt injury caused by the cricket ball, hyphema and secondary glaucoma. As far as industry is concerned, those who work in welding industry, they are likely to have superficial corneal foreign bodies. Those who work in the furnaces where very high temperature is created, they may suffer thermal burns. Farmers may be, because of the insecticides, pesticides, are vulnerable for chemical injuries. Also, while cutting the sugarcane leaf, which is very common in this area, as this is a sugarcane belt, during season of cutting of sugarcane, many farmers suffer from trauma to the eye because of the sharp edge of the sugarcane leaf, causing fungal ulcers. So farmers are also vulnerable to the injuries. Construction workers, as you know, they work with cement and paints and steel, where they are again likely to have injuries. Also, you must remember war injuries. Those who are working, those who are fighting for our nation at the border, they suffer from bomb blasts or gun injuries. Jammu Kashmir, you must be knowing, pellet injuries are very famous because the rubber pellets are being thrown at the population or at the terrorists, and those pellets, they lodge themselves inside the eye, and now this is a very common problem in Jammu Kashmir, pellet injuries to the eye. So these are the you can say populations or professions which are very prone for injuries. Now, why again we stress so much on injuries? Because simple precautions at all these places, so during sports, if you have protective devices, industries, if you work you with use of protective devices, farmers, they take care of their eyes during farming or outdoor activity, many of these injuries are avoidable. That is the importance of knowing this topic, because this is needle, you can say this is needless blindness. If it is avoided with proper precautions, most of this blindness can be avoided. Now, mild injuries require very conservative management, means no intervention, surgical intervention will be required for mild injuries, whereas severe injuries, they will require vigorous, is a very vague term. Severe injuries will require interventional approach, means you will need to do surgery. Suppose there is traumatic cataract, you will have to operate. If there is traumatic detachment, you need to operate. So the proper word will be surgical intervention will be required in severe injuries, whereas mild injuries will be managed by conservative treatment. Now, what are different modes? Wooden stick. Now, wooden stick generally is associated with fungal type of corneal ulcers. So, vegetative injuries. Wooden stick is one of the vegetative objects, or thorn of a leaf, or edge of the leaf, or animal tail, bull horn. All these are vegetative type of injuries. You must elicit history of vegetative injury, because that will help in suspecting fungal ulcers. So these are fungal objects. Stone, a particular thing which is noted in stone crushers. You must have seen people sitting adjoining the roads, cutting the stones. In Marathi we call them as patharvat. So interestingly, if you note down, they come with history of foreign bodies inside their eye. So one may think that it is stone which has gone in the eye, but it doesn't happen so. Commonly it is the iron particle which goes inside the eye, because they use chisel and hammer. So when they are cutting the stone with chisel and hammer, the iron particle goes and enter their eyes, and they come many times with the superficial iron particles in their eyes. Bull's horn may be associated with a penetrating or perforating injury. Motor vehicle accidents, they include fall from height, fall at home. Fist blow is an example of blood trauma. War injuries, they are very complicated actually because they may involve blast particles and it may be associated with collateral damage like fracture orbit, etc. Sports injuries, as I have already told you, badminton shuttle is also one of the common objects which the round end of that shuttle may hit the eye and may lead to subluxation of the lens also, or hyphema, that is blood in the anterior chamber. Now, pediatric age group requires special consideration because the trauma which happens in the pediatric age group, if it leaves behind slightest corneal opacity or other ocular structural damage, may lead to amblyopia. Amblyopia is a term which is known in layman's language lazy eye. As the eye has caused damage to the media, maybe starting from cornea, lens, vitreous retina, anywhere, this will lead to the non-functioning or reduced functioning of the eye. Now, non-functioning or reduced functioning of the eye, brain may neglect the image perceived by that eye in whatever form, and the dominant eye will be used by the brain, and this eye will permanently become lazy, which is known as amblyopia. So at this age, injuries must be avoided any cost, otherwise it will lead to weak eye or lazy eye. Again, trauma, as they are not very aware of the damage, children may have different types of injuries. So the toys, you have to choose very cautiously. The toys who have sharp objects should be avoided because they are likely to cause perforating or penetrating injuries. Bow and arrow is a very common example in India. Especially the RP Center has conducted one study during Ramayana and Mahabharata serials. When the Ramayana and Mahabharata serials were being broadcasted, they were so famous that every household, every child used to play with bow and arrow. And the study conducted at that time recorded highest incidence of bow and arrow injuries inside the eye. So bow and arrow, one has to be very careful while giving to the children because that can lead to perforating injury. Again, vitti dandu. What is that? Vitti dandu, what we call in Marathi, is also known to cause blunt injury or perforating injury to the eye. Also, compass, the children who is school material which they use, scale or compass which has a very projectile and sharp end. So these type of objects can cause severe damage to the eye, and one must be very cautious and one must train children about the damage these objects are likely to cause to their eyes. Now, fingernail trauma is also known by rough handling by the parents, and even firecrack injuries during Diwali festival. Firecrack injuries are known to cause blindness. So there is a lot of movement is going on to ban the firecracks. Firecrackers not only pollute the atmosphere, not only create noise pollution, because they are also likely to cause burns, and if the eyes are involved, that can cause severe visual damage. In India, domestic environment, trauma sustained during outdoor activities, injuries while playing with ball, stone pellets, bow and arrow, wooden top, sticks, gilli danda, as I have already told you. Firecracker injuries during Diwali and other festivals, road traffic accidents, animal attacks, agricultural field and workplace related injuries, injuries sustained in agricultural fields and other places not meant for recreation. Again, one must remember chemical injuries, those who work in the laboratories or those milk, that milk is tested by its degree. There is an equipment to measure the degree to see the purity of the milk. That also contains acid. So if that goes inside the eye, or those who work in car batteries or UPS batteries, batteries contain acid. So those batteries can be a source of acid injury. Those who work in the laboratories itself are prone to have access to the ammonia or other acids or alkalis, are likely to cause injuries. During Ran Panchami, the paint which is used to play, that itself is a chemical which can cause chemical injury to the eye. The old population more than 60 is prone for injuries due to fall or road traffic accident. Again, in this sex predilection, females are more commonly affected than males. Visual prognosis is poor in the old age compared to other population. Now these are the types of injuries: mechanical, chemical, thermal, radiational and electrical. We will have a broad outlook. Mechanical injuries, as the name suggests, there is a contact involved, contact with the object. So the object may be blunt or object may be sharp. Depending on that, there can be closed globe injuries where the wall is not opened. So sclera, cornea, conjunctiva is not opened, but just because of the wave of the object hitting the eye, there can be mechanical disruption of the inside tissues causing injuries to the eyeball. This is known as closed globe injuries. Fist, hitting with the fist, cricket ball are the examples of closed globe injuries. Open globe injuries is bow and arrow or sharp objects, where there is a full thickness wound to the sclera or the cornea or both. From that full thickness injury, wall is opened, inside contents may come out, iris may come out, or uveal tissue may come out, vitreous may come out, lens may come out. These are the open globe injuries. Also, as the wall is open, the hitting object will bring lot of organisms with it, and those organisms can enter inside the eye, causing endophthalmitis or panophthalmitis, that is infection. That is a risk with open globe injuries because it is associated with the infection. The organisms may enter. So it includes rupture and laceration of the eye. Chemical injuries are all emergent injuries are emergency in the ophthalmology, but chemical injuries again is a dire emergency, because the more the time is lapsed from attending the patient since the chemical injuries, high chance of patient losing his vision is there. So chemical injury is an emergency. We will have a separate lecture on chemical injuries, and the first aid is extremely important. You have to dilute the chemical, whether it is acid or alkali. Bring the pH to the neutrality as early as possible by washing the eye. This is the first and foremost principle of chemical injury. So it is an emergency. It involves acid and alkali. It involves long duration follow-up because the treatment involves immediate treatment, intermediate treatment and late treatment, because it has late consequences to the eyeball like dry. So chemical injuries are very important from that point. Thermal burns occur from fire or hot fluids. Bilateral involvement of the eye with delayed onset 2 to 3 weeks after the initial burn occurs. Conjunctiva and cornea are affected in severe. In thermal burns, one has to mention those workers who work near furnaces in the industry. In the furnace, they melt the metal, they melt the iron, and the fluid is created from melting the iron. So one can imagine how much temperature must be generated at the furnaces. It is a very huge temperature which melts the iron, and then that fluid is put into the cast, and different types of engines or machines are prepared. So the workers who work near these furnaces, they suffer from thermal burns. So it is the best example of thermal burns one has to remember. Electric injuries, those who work in the electric poles or during electric appliances are likely to suffer from electric injuries. also flash of lightning. Now this passage of electric current to the eye involve the injuries like conjunctiva becomes congested, iris ciliary body gets inflamed, lens shows electric cataract, which is posterior subcapsular type of cataract, retinal hemorrhages and optic neuritis. Radiation injuries are extremely important again. One example is ultraviolet radiations. Sunlight is the best source of ultraviolet light, where UV, different kinds of ultraviolet radiations are there in sunlight, and the best example of the damage caused by ultraviolet light in the eye is pterygium. So pterygium is the best example. So ultraviolet light from the sun is also dangerous. It can also lead to cataract, senile cataract. Also radiation, those who work on the computers, that is a big now topic for study. The condition is known as computer vision syndrome. So computer vision syndrome is nothing but patients exposure to the radiation, low dose radiation emitted by the laptops or mobile or computers. So these can have an effect on the tear secretions of the eye because of through various mechanisms leading to computer vision syndrome. So this is one of the examples of radiation injury. Again, snow blindness, where the reflected UV rays from the snow. If you see those who are involved in the sports related to snow, skiing and those things, they use separate type of goggles. This is to prevent from the snow blindness. Again, the fishermen who work in the seas, they are exposed to the sunlight reflected from the sun. That reflected light also is very dangerous to the eye. So that can lead to the radiation injury. Again, infrared radiation, solar retinopathy or eclipse. Normally one is not able to gaze at the sun for a long period because that light is not tolerable to our eyes. But what happens is, if patient is psychologically disturbed, he come under some ritual influences where they are told that gazing at the sun will improve their eyesight. They tend to look at the sun for a long period. Those types of psychiatric people are vulnerable for solar retinopathy. It damages the macula. Or what happens during solar eclipse is, so sun becomes tolerable as it is covered. Now sun is like moon. Moon you can gaze at for a long period. It is very quiet light. Sun becomes moon-like during eclipse because it is covered. So one has a chance to see at the sun for a long period as it is tolerable. So one tries to see or gaze at the sun for a long period. But what happens is, the corona, which is the surrounding solar part, which is uncovered during eclipse, that radiates harmful radiation. So if that is exposed during solar eclipse, so main sun may be clouded and patient tries to see at the sun for a long period. While he is seeing or gazing at the sun, the corona, which radiates harmful ultraviolet radiation, the rays from corona enter patient's eyes, causing solar eclipse burn. That is known as eclipse burn. So these are radiational effects. Also the effect may be direct or indirect sun viewing. Welding arc exposure also is an example of radiational maculopathy. Lightning retinopathy or retinal phototoxicity is also known from ophthalmic instruments like operating microscope. Ionizing or radiational injuries caused by radiation therapy. You must be knowing radiotherapy, which is done for cancer patients. Now this radiation therapy can be damaging to the eye in the form of, it may cause keratoconjunctivitis or it may cause dermatitis of the lid. The severity of the keratoconjunctivitis depends on the amount of radiation used for therapy. Radiation can cause cataract. So infrared cataract lead to discoid posterior subcapsular cataract. which is seen in the workers of glass industries, also known as glass blowers or glass workers cataract. Irradiation cataract, exposure to X-rays, gamma rays and neutrons. 6 months to few years is the time between exposure and development of cataract. Injuries with non-organic and organic materials. Organic materials tend to produce proliferative reaction and formation of granulation tissue. Injuries with leaves, rods, thorns, wood, caterpillar hair are organic injuries. Injuries with glass, plastic, stone, gold, silver are non-organic materials causing injury. Some of them like glass or gold are inert. So one may leave behind the particles of glass if they are not causing any harm, because they are supposed to be the inert. But the particles like iron, siderosis, copper causing chalcosis, they lead to severe inflammatory reaction which cannot be kept inside the eye. So these are injuries with non-organic and organic materials. So in this lecture we have tried to impress upon you the importance of injuries, how injuries can be avoided. Avoiding injuries, you are preventing needless blindness, otherwise it is a needless blindness which you prevent by avoiding the injuries. So importance of injuries and various types of injuries, how various age group people are vulnerable to different types of injuries, how health education or providing protective shields to the vulnerable population can help in preventing the patients from getting injuries. So this was a brief introduction. Next time we will have a discussion on chemical injuries. So our entire lecture next time will be on the chemical injuries. Thank you.